Hello. In this video, I'm going to talk to you about brain attacks or strokes. Recently, we had observed the World Stroke Day. So on this occasion, I'd like to raise some awareness about this very common neurological problem. Let's go into the video. So what is a stroke? We are all aware of a condition called heart attack, where there is a sudden block in the blood vessels of the heart, which leads to the heart stopping suddenly. Similarly, if this happens inside the brain, we call it a brain attack or a stroke. So there are two types of stroke. One is the ischemic stroke and the other one is the hemorrhagic stroke. In an ischemic stroke, as I told previously, there is a block in the blood vessels which leads to the symptoms of stroke. The second type, or the hemorrhagic type, is less common, but there is rupture of the blood vessels and bleeding inside the brain. So this is a more serious type of stroke than the first one. What are the risk factors of stroke? So hypertension or high blood pressure is the most important risk factor. Other than that, high blood sugars or diabetes, obesity and high cholesterol, alcohol consumption and smoking as a habit, all these are important risk factors. In addition to all this, having a heart disease called arrhythmia, especially atrial fibrillation, leads to abnormal rhythm of the heart, and this increases the chance of you having a stroke. What are the symptoms of stroke? So we remember the symptoms of stroke with a mnemonic called B fast, where B stands for balance problems. You can have a sudden dizziness or an inability to walk. This can also be associated with a severe headache. E stands for eye problems, where you can have blurring of vision or it can be double vision. F stands for facial droop, where you have a weakness of one side of the face, which can be a problem in closing the eyes or deviation of the mouth to one side. A can stand for arm problems, where you have weakness of the arm or you can feel numbness in the arm on one side. S stands for speech problems, where there is a slurring of speech suddenly. And T means that you should not waste any more time and quickly go to the hospital to get treatment. So how is this condition treated? If you reach the hospital within 4.5 hours of sustaining a stroke, you can be given an injection called TPA or thrombolysis, which is basically injected inside your veins, and this clot can be dissolved immediately and you can return to your normal condition. But it has to be done within 4.5 hours. So it is important to recognize these BFAST symptoms and reach the hospital immediately and confirm that you do not have a bleeding inside the brain or you do not have the second type of stroke, which can be easily done with a CT. So if you qualify, you can be immediately treated with this injection. I think this video must have been useful. I request you to share this video to increase awareness among the common public about stroke and its treatment. Thanks for watching.